726. Let's talk COVID now. From the Department of Public Health and Social Services, the medical director, Dr. Janna Manglona. Good morning.
Good morning. Thank you for having me.
Oh, we missed you.
Yeah, we did.
This isn't going to happen again. No, I mean missing me. I'll be back.
Oh, good. Oh, good. Oh, good. Okay. And so we got you on the Zoom here. And thanks for joining us, Dr. Manglona. We're really, anytime we see a surge in the positives, we want to bring on someone from the public health community to kind of speak to the people about it. So we'll just start there. There have been, the surge in positives the last few days and over the weekend. So we'll just start and give you the floor. And if you could just give us the latest information on that.
Basically, a lot of our recent cases have been coming through travel. And the community spread is small, but we've had a lot of cases that were linked to each other through travel. And so the number looks higher, but you have to realize that when people come in through travel, that most of them are in the quarantine situation. And so most of it's contained. Now, having said that, if people are on home quarantine and if they don't abide by quarantine, then spread can occur in situations like that as well, which is why the Gov Guam has said there will be penalties if you don't quarantine, because then the opportunity for spread throughout the community is greater if people who... So luckily, we still have our quarantine in effect. And so when most travelers come in from high-risk areas, many of them will be placed into our Gov Guam quarantine facilities. And so, although they may be positive, most of them is contained.
There's been, I think I've seen it on, is it the FSM Association of Guam's Facebook page?
Right.
And it's been going around on social media about, was it a funeral or something like that?
Yeah, and Doc, we had talked with the Chickees Association of Guam, and apparently what they were telling us was there was someone who had come in for a funeral service, and now the FSM community and the Consul General, in conjunction with the Chickees Association of Guam, they're trying to do an outreach into the community. And we were told it was relative to, we were told by the Chickees Association that it was relative to some COVID positive. So are you able to shed any kind of light on that?
We, same report that you received. We can't confirm it, but when people are coming forward and offering you the information, I don't think they're making it up. So they're reporting that based on information they've received, and we have heard the same things, is that it was linked to a funeral and people had come in for that. So yes, we heard the same. I'm glad you heard that separately. I can't obviously comment on where or what, but we were told by some concerned FSM persons as well, right, that they had heard that. But wherever it came from, be it there, be it anywhere, again, quarantine. You know, that's the way we control it. And we jokingly say it, but quarantine is the most effective vaccine we have. Mm-hmm. And when we put people away for 14 days and tell them stay at home and to isolate, that's the only thing we have to control the spread and control the disease itself and keep the curve flattened and contained in Guam. And until there is a vaccine, that's all we can do, and it's so effective. Mm-hmm. But we'll see surges when things like that are occurring with events and where people don't remember to wash their hands, socially distance, and wear the mask. And those things are so effective. Mm-hmm. And when it isn't used and people disregard that. That's how spread occurs, and often with bad outcomes.
And Dr. Cabrera was on, I think it was yesterday, and he was saying that the one of the biggest threat, if not the biggest threat, is people that are on home quarantine that aren't adhering to these home quarantine protocols. But how would I know, for example, if someone was on home quarantine
Right.
and not following protocols? And how would I,
You
I
won't.
wouldn't know to
You won't.
report them so
You
that they would
won't.
be
You
held
won't know
accountable.
that. Yes, you won't know that.
Mhm.
And so that's why we have to tell everyone to use universal precautions. Because another thing, too, is that 1 in 3 people with COVID have no symptoms. So then you say, so what do I do? Here's what you do: 6 feet, mask, wash your hands. And then the odds of your getting it go way down.
Right.
So if that person next to you has no symptoms, even sitting where you are, if they have no symptoms, they may still transmit the disease. So I'm when all the airmen went out into the community, uh, apparently people were doing what they were supposed to be doing because
Right.
we didn't get cases from those. And that's a good example. People cannot let their guard down. And we have an education campaign coming out right now for wearing masks. I don't have to have one on right now, but I feel so guilty to come on with my role with public health and not wear one.
Yeah.
But
Yeah.
I don't really need to. I'm inside my home. No one's around me. But
You're just
I
setting
don't
an
want anyone
example.
to walk. Sorry.
You're just setting the example. We get it. That's what we're trying to do here too.
Right,
Yeah.
right. I feel like I can't show my face when I'm telling people not to do that. But it's everywhere around you, possibly. So do wear it, socially distance 6 feet, and wash your hands. And we won't be having this conversation for long.
Right.
Mhm.
But
Doc.
when people violate that, whether they're known to be cases or not known to be cases, when you violate that, it's going to spread. But I would have the comfort if I were to find out that I'm positive. I'm not really worried. I mean, doing a contact investigation would be um, fairly straightforward with me because I
Right.
don't go without this and I do socially distance. And maybe there's a foot or two breach here and there, but if you abide by the things that we know to do, and that's when you're out and you don't know what your status is, then you can worry less that you infected anyone.
Right. I think I'm benefiting from this because I've always had kind of a small circle, and if you're right, if I was to somehow get positive, I feel like to do the contact trace investigation would be pretty easy. It'd be like, oh, okay, done. Doc,
Yeah,
I want to.
Right.
I just
Right.
brought that up because we're discussing enforcement and stepping up penalties, but I mean, like I said, I just don't see how we would be able to report people if we don't know who they are. And having said that, are there discussions of possibly releasing a list of people that are on home quarantine so people can know and report these individuals that
I
could?
think everyone would like that, but everyone has rights.
Mhm.
And I remember when AIDS first came out, and I was sitting with a couple, and he was a known case. She was 5 months pregnant and did not know that he had it, and I wasn't permitted to tell her. And so I tried to implore the partner to tell her, and at that point, he wasn't willing to. And so it's really frustrating because the rights of people come first. And so knowing that, you have to protect yourself because everyone has rights, and we don't have the opportunity to come out and say yes, yes, yes to everything, and
Right.
we'd like to.
Yeah.
But it doesn't. Even the ones you identify with it aren't the problem. It's the ones that you're sitting next to that you don't suspect that are the problem. If you think someone has it and you hear them coughing a lot and they look ill, you're definitely going to distance. But the one that might bite you is the one you're whispering to, saying, I think that one has COVID. Maybe that one has COVID. So that's why it's very important to adhere to what we know we can do to prevent it. And the health department is coming out with an education campaign, and we've made 9 videos with our frontliners, and we're going to release those one per week through the radio, TV, and through our social media to really advocate for using these safeguards to protect yourself and the community, your friends, your family. It's so important that we go over and over this, but we can't say it enough. We have to take care of our families, our friends, and our community. And the only way we can do that is doing these little safety measures. And also, I noticed that Dr. Fauci this week even mentioned wearing goggles. Why did he say that? He said it may come to that point, but actually, you can just wear glasses. And why he said that is that where you have wet mucosa that helps guard against infections, you'll have it in your nose, your mouth, and your eyes. So that's another port of entry for the virus.
Mm,
So we don't tell people to wear any kind of eye protection, although we do when we're on the front line, we wear eye protection
yeah,
and face shields.
right.
Face shields are great,
Yeah.
but anything to prevent the virus from getting into the mucosa.
Well, Doc, I wanted to ask, with the quarantine exceptions, right? So going back to what we had discussed earlier, and not even specifically, but just more generally, there are people we hear who come to Guam for funerals, or there's a list, right, of exceptions. That being said, and you talk about people, breaking quarantine, do we kind of maybe, in your opinion, your medical opinion, need to re-examine some of these exceptions, or maybe more closely monitor the people who are being granted these quarantine exceptions?
Well, actually, what we've done, there are people that I would say, expedite their quarantine, but now we've changed the protocol to where they have to be tested. So you may be permitted to do your job or go to a gathering, but now we expect a test to be done and a letter from the director or someone with valid credentials or papers. It doesn't take a director's letter, but when you come into the airport and you have one of these situations, you will be expected to provide documents that support that so we can do rapid testing and feel safer about letting you go into our community. But even when we say you can go out, please, the mask, hand wash, and socially distance, because when we check contacts, if we find a case, the way we do contact tracing is we go to you, and please work with us when we come to you. We won't ask you for anything like your credit card or banking information. All we want from you is your help in identifying people that you may have exposed. And so we need your help in and holding our hand, guiding us through your steps before about 48 hours before you were symptomatic or found to be positive, and then walk us through your daily life so we can reach out to those other contacts. And in general, the contacts that we'll be looking for, it isn't everybody. If you saw someone at the grocery store and you just waved, I mean, that doesn't constitute a contact. What we're looking at is closer a closer proximity, maybe less than 6 feet and longer than 15 minutes. So people who are in your car or someone that is inside those perimeters will be looking for those people who have a greater risk of becoming positive. And so we will reach out to them and we'll monitor them. And that's what we're doing now. We've done contact tracing and contact investigation for years with infectious disease, and we do it daily with TB. And now we've ramped it up and we include COVID. So we not only address the case, but we also ask you for contacts and we contact them. And then we watch them for 14 days as well. And we have digital tracking that helps us with this. We have the AMOCA program.
Right.
And there are a large part of the community that are on the AMOCA program that we have.
Right.
Is
And
the
we literally have
AMOCA
video.
is the AMOCA app for people that are on quarantine though, or COVID cases? Because
We
Senator
have mixed people on it. We use
Okay.
high risk people and people who are positive and already known positive. We wouldn't use it for the low risk. We're looking at another program to launch very soon called the Sarah Alert. And what that would entail, and what we envision logging people into that system when they come to Guam. And we have a line list of people, and it would sorry about the choke. Sorry about that.
You okay?
Okay.
Yeah, let me get a sip.
All right.
Hang on just a
Yeah.
second.
By the way,
But
where
we're
do we
hoping
get
to
these
get everyone
turtlenecks?
logged into the system. And then the system itself does the monitoring for you. It will contact the people and reach out to them to say, hey, remember to log in whether you're having any symptoms or no symptoms. And so it takes the burden off of staff having to physically call you, and then someone monitors that daily log.
Yeah.
And if we need to reach out and monitor and get you help, we can do it rapidly if we use that system.
Doc,
Is this similar to what Senator Rigel has introduced, Bill 387, regarding digital
I'm
contact
not
tracing?
sure what they've introduced,
Mhm.
but what we're using is a combination of hands-on phone calls and physical visits to some of the more ill people or someone who's indicated that they need a closer monitoring. We do field visits on them. We do phone calls, and then we already do the AMOCA program. Sarah Alert is going to be launched not just for ill people, but hopefully for the passengers coming in who aren't ill, and we can still monitor them. So there are a longer arm monitoring system set up for them.
right.
And we're also looking at another one called Path Check Foundation, and in that one, it it uses GPS in your smartphone, and it shows where all you've been. And if everyone logs into that system, then if someone becomes positive, then it will alert other people. It'll sort out where you've been to notify you whether you were in close proximity to someone who actually had COVID.
Wow.
So we're looking at that system as well. For sure, Sarah Alert, and we're already using the AMOCA, and we will always use um, actual individuals to reach out to people.
Doc, you know,
Combination.
we hear just the chatter about possible abuse with these quarantine exceptions. Who would monitor that thing, and is that information public? Because I'm not sure if that would be covered under HIPAA if you got an exception to skip quarantine because of whatever reason. So we just hear reports about people being pulled out of line at the airport, and as always, when we get this info, we want to vet it. So have you
Right.
guys heard anything about any type of abuse with the exceptions to quarantine, whether it involves, government officials or their families or friends or anything? And then who would monitor the incoming travelers for that type of thing? And is there any vetting that goes on with who gets the exceptions to these quarantines?
Actually, it's interesting. An exception. We don't. They're really. Everyone is quarantined. Everyone is, and it may be a little expedited. It might be slightly expedited for like frontline essential healthcare workers, where we test them sooner. They must come in with a test or be tested within 24 hours, and their families. And then we would allow home quarantine for them, and they can go to and from work. But at all times during that entire period, they must adhere to socially distancing, wearing the mask, and hand washing. So everyone is tested. The protocols. You don't just get a free pass.
Okay.
So you will have a test.
All
And
right.
and test something's better than nothing. We know that tests aren't everything, but I want it on everyone, ideally, because
Doc,
at least we know they're not positive right then.
right.
And when they enter Guam, it's nice the more people who are tested, because we know at least right then that they're not a positive, because we can weed them out from the very beginning.
Right. There's a lot of, we've had Dr. Ho on about the window for testing someone, and in terms of like when they were exposed to COVID and when they would actually pop positive. Right. So that's part of it too, right?
Yes. In general, the 14-day quarantine isn't a magic number. We look at the life of the virus and how long it takes to get into the person. We call it the host. But how long does it take? If I'm exposed today and I'm going to get it, how long does it take? Usually within 5 days, people are symptomatic, but we can pick up about 97% of the infections by day 10 or 11. So 14 gives us 99% by 14 days. So knowing that, we adopted that. And it may seem a little excessive, but we're getting almost 100% of the cases by going the full 14 days. And when we timed this test out of quarantine at 7 days on the new protocols, we're allowing for that front line few days before you get here, plus the 7 here, knowing that by day 10 or 11, 97% who are going to get it and actually get it, we will be able to pick up. And so that's what we're doing in the quarantine facility. When people come from off island without a test from a high risk area, we now call it a non-low risk area. We quarantine them, and then guess what we do? In 7 days, if they want to, we'll test them. And we've had several positives come from that test at 7 days. And they're in disbelief, especially if they have no symptoms. And now, if you don't opt for that test, you go for the full 14 days in the quarantine facility. So it's been so effective. We've saved ourselves probably 20 cases in the past 2 weeks. And I'm pulling that number out. It may be 3 weeks, but that's 20 people who would have been in the community had we not had the quarantine facility. And without going to a gathering, we're looking at about 15 contacts per person. So you're looking at 300 people,
Right?
And that's without going to a gathering. What if each of them went to a gathering? So it's easy to see how this gets out of hand. And as we start to open, the more programs that we can have in place to help prevent the spread, the better for us.
Doc, can we get any info? We had a call earlier about the next mass community testing. Anything on you guys' radar for that?
I don't have my schedule in front of me. We did Chalampago yesterday,
Right.
but I'm sorry, I don't have the schedule. I've got the sit rep, but I don't think I can call it up on my computer. Want me to go get the computer? Because it's listed on our website. Our website is...
Bree's got it. She's on the...
Yours?
Yeah.
Okay.
I'm just looking at it.
Doc, well, thank you so much for your time.
Yeah, I just wanted to also just acknowledge and say you guys are doing a great job with the Division of Environmental Health. I've been getting a lot of the inspection reports, and Tom Nadeau and the health inspectors, I mean, they have been going out. I get it every week. They've been shutting down. They've been inspecting, citing different restaurants that aren't meeting the guidelines that have been set up for public health. So, good job to you guys.
Could I go through just a few more things to see if there's anything else I wanted to share with you? Because I've got lots. It might take a couple of minutes just to share with you. Would that be okay?
Of course, Doc.
Okay. First of all, thank you for giving us the opportunity to help launch our education campaign for masks. Please, we thank the community for what they've done. Guam has contained the virus quite well. We do see surges of cases coming in, but it's easy to identify the sources of that because of the systems we have in place. And we see that quite factually, if people don't abide by the recommendations, what can happen? So thank you for giving us this forum to get the word out, and we really appreciate it. Okay, contact tracing, we went over that. There were some key points that the department wanted me to bring out. We have contact tracers who sit on the phone and get the information. Then we have contact investigators, which is a little different. They're the bug detectives. They actually get out there and search, seek, and destroy. So we do need help. And when I say we need help, we're okay now, but we're trying to prepare for the future as we continue to open Guam. So we see a need that we may need more individuals in addition to our digital monitoring. And so please look at the DOA website. There are positions opening. We identify more. Even this week, we've identified additional positions that would be available. So please look. If you're looking for work, we would love to have you join us, because this is something that has placed each of us on the front line, and everyone is doing their part. So we can give the tools and the weapons to the community, but ultimately the battle is fought by the community. Everyone is on the front line for this. So it was funny. I had someone call in the other day and said, what is your expertise in treating COVID? And I said, google.com, what's yours? Because it's new. And so we're all watching this evolve at the same time. And our army is you. So please continue to do what you're doing. Get the word out. Simple things like this and socially distancing will save lives. Let's see what else. Close contact. We went over that. We're looking at, in general, 6 feet and 15 minutes or more. And let's see here. Oh, let's talk about, just for a second, what tests do we accept? We've had that question come up. Are you all still there?
Yeah,
Yes,
we're just giving you
we're
the
here.
floor.
Okay. Sorry. I just wanted to hit that before we go. But the tests that we accept, we do accept, these are big words, I know. It's a foreign language. PCR testing and antigen testing and molecular testing on the Abbott ID Now. What are those? Those are tests that actually look for the virus. There are tests out there that look for your response to the virus and antibody testing, but those haven't been fully developed yet to being a useful tool for clearing people. So we advise against using that test for clearing. So the tests that actually look for the virus, and I even accept tests from Asia because they may not have the emergency use authorization that our tests have, but they have their own. Like Korea came out with the first one in February. They were the first ones in the entire world to get an EUA approved test through their own CDC branch. So we accept those tests. If it looks for a virus, we accept those. So I think that'll answer that one. Let's see if there's anything else. I think those were key things that I wanted to share with you all. Oh, Japan. Just so you know what our brother and sister countries are doing, Japan is starting to open up testing at the airport with the antigen testing. They get results in about an hour, but I think Haneda and Narita airports have started testing at the airports in Japan in their efforts to open up. So as we open up, everyone has to do their job. You are our soldiers. So please do your jobs, and we can contain this thing as we open, because we all want our island to open. And we have to do what we can do. It will expand our testing, expand our surveillance, and hold hands and get through this.
All right.
Okay.
Thank you, Commander.
Hold hands. I know you meant that metaphorically.
Hold hands at a distance.
air holding.
2 arm lengths.
Air
I'm gonna
cuddling.
go like this.
All right. Thank you, Doc.
Thank you for having me on.
Yeah.
Enjoy talking to you all again.
Always, anytime you got any of those announcements you want to make, just text me. We'll get you right on, okay?
I'll text you. Okay.
Yeah.
All right.
Okay, thank you.
Great.
All right,
Thank
wash
you.
your hands
Thank
and
you
your
so
thumbs.
much.
All
All
right.
right.
All right, there you go, Dr. Janna Manglona from
Commander
the
Manglona.
Yeah, 753. Wow, it's a lot of information there, and now we're way behind, so we're just going to jump right back onto our Zoom feed and bring on from the Guam Federation of Teachers, the president, Tim Fidenko. Good morning.